Welcome back to our channel, where we explore all things pregnancy, from conception to delivery. If you're new here, make sure to hit that subscribe button and ring the bell to stay updated on all of our pregnancy-related content. Hi everyone, I'm in today's video. We're talking about something that's on a lot of people's minds, week 2 of pregnancy. You might be thinking, wait, how can I be pregnant in week 2? Isn't that too early? And that's a great question. Let's dive into the fascinating world of early pregnancy symptoms and how your embryo is developing at this very moment. So let's get started. First things first, week 2 of pregnancy doesn't technically start with the embryo. It actually begins on the first day of your last menstrual period. Confusing, right? Well, the way doctors calculate pregnancy is based on your last period, not from the date of conception, which usually happens around week 2. So, what's happening during this week? This is the time when your body is preparing for ovulation. It's when your ovaries release an egg. And if you've been trying to conceive, this is when you might be most fertile. Let's talk symptoms. While you might not feel pregnant yet, some subtle things can start happening in week 2. Some women report feeling slight changes in their body, even in the early stages. Here's a rundown of common symptoms in week 2. 1. Increased cervical mucus. As your body gears up for ovulation, you might notice more cervical mucus, which becomes thin and stretchy. It's your body's way of helping sperm swim more easily to the egg. 2. Ovulation pain, Mittelschmerz. Some women feel mild cramping or a dull ache on one side of the abdomen, which could indicate that ovulation is happening. 3. Breast tenderness. Although this is more common later in pregnancy, some women report breast tenderness around ovulation due to hormonal changes. 4. Mood swings. The surge in hormones like estrogen and progesterone can cause mood swings. So don't be surprised if you're feeling a little more emotional than usual. 5. Light spotting. Some women may experience light spotting around ovulation, which is completely normal and not a cause for concern. Now, don't panic if you don't feel any of these things. Every pregnancy is different, and many women don't experience symptoms until later. Now, let's talk about what's happening inside your body. Even though you might not feel it, your future little one is already on a journey to development. After ovulation, if sperm meets the egg, fertilization happens in the fallopian tube. The fertilized egg, now called a zygote, begins its journey down to the uterus, dividing and multiplying cells along the way. By the end of week 2, your fertilized egg is now a blastocyst, a tiny ball of cells. This blastocyst is about to implant into the lining of your uterus, where it will continue to grow and develop into an embryo. At this stage, the blastocyst has already begun differentiating into different layers that will eventually form all the parts of your baby's body. As we move into week 3 of pregnancy, this is when implantation will likely happen, and your body will start producing the pregnancy hormone, HCG, which is what pregnancy tests detect. This hormone helps to maintain the pregnancy and keeps your ovaries producing progesterone to support the developing embryo. You may start to notice signs like a missed period, fatigue, and more noticeable changes in your body as the embryo grows. So, while week May 2nd feel a bit uneventful, it's actually one of the most crucial weeks in your pregnancy. Your body is laying the foundation for what's to come in the next few weeks. And even though you might not feel it, a lot is happening inside you right now. By the end of week 2, you might be wondering when to take a pregnancy test. Most tests will tell you to wait until you've missed your period to get the most accurate result. That usually happens around week 4. Taking a test too early, before implantation is complete, might lead to a false negative because your body hasn't produced enough HCG yet. Of course, if you're really eager, some very sensitive pregnancy tests can detect HCG as early as a few days before your missed period. But remember, patience is key. So there you have it. Week 2 of pregnancy may not come with many obvious symptoms, but it's an exciting time of development. Your body is preparing for the miracle that is to come, and you'll soon start noticing more changes. Remember, Every pregnancy is unique, and if you're feeling uncertain about anything, always consult your healthcare provider for guidance. If you found this video helpful, be sure to give it a thumbs up. Share it with someone who might be in their early pregnancy stage. And leave a comment below with any questions or experiences you'd like to share. We love hearing from you. Thanks for watching, and we'll see you in the next video. Take care, and best of luck on your pregnancy journey.